A New York Times article has created buzz amongst new parents and pediatric dentists alike. Tongue tie releases and the perceived booming surgical release business. Here to debunk the myths and provide their balanced professional views, please welcome back to the show Drs. Lynda and Krystle Duru. Ladies, it feels like a family reunion every time you guys are back. I'm so happy to see you all. How are you doing? First of all, Happy New Year.
We're amazing. We're grateful. We're just happy to be here and still treating our patients.
Yes.
And it's a new year, and you know, we're moving forward.
I love it. I love it. And thank you so much for sending this article to me. As a new parent, of course, this is something I'm interested in. So tell us more about this New York Times article talking about tongue tie releases and the booming, it said booming, business of surgery. I believe, I was looking into it, they're basically saying that there's some pediatric dentists who are preying on parents and saying you need surgery for maybe monetary reasons. So what were your immediate thoughts after reading the article?
Oh, it was very emotional for us, and especially, you know, as a team, we wake up every day trying to unlock the God-given potential for every child we see.
Absolutely.
And normally that includes making sure that beyond teeth, we're looking at their health, their sleeping, and how well they're growing. And all of this begins at infancy with proper breastfeeding. And so that New York Times article, while it was a little disheartening, they brought up some important things that we agree with. For starters, why is this training not included in medical and dental training curriculum? And so that makes it a little bit more difficult to be able for people to understand what the standards are and how important it is as well. So that, Dr. Krystle, I'm sure you have some your thoughts on that as well.
I think you're bringing up good points, and that article did elucidate and bring to light that, hey, we need to be able to look beyond just the tongue. Some things can mimic a tongue tie, but it is important, regardless of anything, it is important to be able to see, why is my baby not feeding? Why is my baby having colicky and just feeling tight and things like that? And so having that article helped a lot of people see that, hey, you have to go beyond just snipping. It's not just a snip, which is what we talk about all the time.
I love that.
You have, it takes a team, and a good pediatric dentist will be the quarterback to be able to find that team and make sure your baby is ready and does actually have a tongue tie, or be able to, you know, release the tensions that cause neurological fight or flight before snipping or doing a irreversible surgery.
And you all have three tips to parents for making informed decisions with the tongue ties. Dr. Lynda, can you go through these tips with us quickly?
Well, we say look beyond the tongue tie, look beyond the tongue, because many things can mimic a tongue tie. And the baby comes through, the birth canal is very tortuous, so they come very compressed when they come out. So that's usually making it more tense and not having the neurology, having the nerves communicate. So some things will mimic the tongue tie, like low tone, or having difficulty breathing, that's called laryngomalacia. So those sort of things will impact the baby as well. So we take on
and then the second one, we have that full screen. Get the right team on your side, which I know the right team, the winning team right here on the couch.
Get the right team is so important, and that's why we consider ourselves a quarterback, because sometimes you may need someone who is specializing in pediatric chiropractor, a craniosacral therapist, pediatric osteopath, someone who understands things beyond just what they're seeing, and be able to get that baby ready for the tie release before and after. So having the correct team, because this whole thing, the tongue is connected all the way down to your tip of your toes to body fascia. So when you're coming out into this journey or into this world, you really have to make sure that your nervous system is intact and ready for surgery and things like that.
And we have an image there. It's so, I love when you all say that, because it's something no one knows about. And quickly, before we have to wrap up, I love that you all have non-surgical options, because that's one thing they were talking about. Is every parent is scared of that word surgery.
Exactly.
So you all have non-surgical options. We have about 30 seconds left. Dr. Lynda, can you tell us about them?
Well, yes, it's called a baby laser, and it's a laser, you think of it, laser and light therapy. And so this laser is able to loosen up that tightness in the body and help the nerves to connect properly so that they can actually send messages to the brain, to the tongue, and the whole body. And it's breastfeeding can sometimes be achieved.
Yep.
About 30% of babies we see with that collaborative care and therapy don't need to have the cut. They can just start feeding because now you've got the neurology together, the brain knows what to do, send signals to the tongue, and babies not much tension anymore.
Yep.
They're able to feed properly.
Love it. And we have a flow code for everyone watching. If you would like to get in contact with Dr. Lynda and Dr. Krystle, they're an amazing team out there in Ashburn Dentistry. Please put your phone up to the screen now, grab that code, you'll get connected to them, and then you can ask a question directly to the doctors going to our website, dcnewsnow.com/growinghealthyfaces. Ladies, thank you so much. I wouldn't trust my baby with anyone else in the world but you two. Thank you so much.
It's a pleasure. Thank you for having us.